Good day, everyone. My name is Dr. Kelechi Ohiri, and I will be speaking to you today about the use of performance routines to monitor progress. By way of a bit of a background, I have about 15 years experience in the health sector, spanning both clinical medicine, consulting, advisory services in both public and private sectors. I've served as a senior advisor to ministers of health and finance in Nigeria. And prior to that, I had a career in management consulting with McKinsey and Company, as well as a career in development with the World Bank Group, focusing on health systems in emerging markets. I currently sit on the board of the Alliance for Health Policy and Systems Research in WHO. And this presentation today will be sharing with you how to use performance routines to monitor progress using Nigeria's malaria program as an example. So hope you enjoy it and hope you find it useful. So we'll go right into it now. You must be seeing the particular framework. It's called a hairdryer because it is somewhat shaped like a hairdryer, but what it tries to do is capture the routines that are involved in a typical performance management framework. You find out that when you actually implement it, that the key function of governance is to actually manage the performance of a health system. In order to do that effectively, you need to have certain routines that help you achieve your set objectives and reforms. This performance management tool can be useful in setting routines either quarterly or yearly. In this case, we used it quarterly for managing progress. It's an iterative cycle, and that has about 4 major steps involved. The first step is actually setting your plans and performance agreements. In this, you will set targets that you will align on. The second is reporting. The third is reviewing. And the last is sort of revising what your targets are based on the outcomes of implementation. So we will go into this in more depth in subsequent slides, but I'd like to encourage you to look at this and adapt it to your own particular circumstance. And you find that you keep iterating until you get to a point where you've achieved your aim and then exit the performance management cycle. First, let's look at setting targets. So the implementation process begins by aligning your targets, milestones, and implementation plans and performance agreements. So most ministries of health, you start by having set targets at the national or at the state level. These targets tend to be drawn from recommendations, either global targets or in a very decentralized country like Nigeria, from national level targets. So sample indicators, for instance, would be, in the case of malaria, household ownership of long-lasting insecticide-treated nets, for example, or intermittent preventive treatment of malaria in pregnancy. Outlined in this slide are certain indicators that we used in the Nigeria Malaria Program and the Nigeria Malaria Strategic Plan. We selected these targets at the national level, and the downside to this is that when you select national level targets, you don't really consider the implementation constraints across many states. For example, we aim to meet the national target of reaching pre-elimination levels of malaria prevalence amongst children by 2020, as well as a national target of 80% diagnosis of malaria using RDTs or microscopy by private facilities by 2018, and reaching a target of 100% by 2020. Naturally, in a heterogeneous country, the rates at which you achieve these targets would vary. And so the key thing to note here is that whereas setting targets are important, adapting it to the context is equally more important, so that you set targets that are realistic and take into consideration the context within your country and the ability to implement and get to those targets. The next step in the performance management cycle is the production of reports or data. Because as implementation of programs continue, holistic data must be collected to report against targets. That gives you a sense of whether you're making progress or not. And this has always been a challenge. If you've ever had to collect data that's accurate and representative, you would be familiar with these constraints. For example, in Nigeria, we faced a challenge. We had so much data from many sources, particularly from surveys. You had the malaria indicator survey for malaria, the SMART survey, the service delivery indicators, and several surveys. Now, it's important to invest in surveys, but one of the weaknesses of surveys is that they occur, for instance, every 5 years. So they may or may not be appropriate in your system for actually tracking progress. In Nigeria, what we did was then we began to invest in strengthening the routine health information systems, because those will give you data on a much more frequent basis. And because of the investment in strengthening data, routine reporting rates increased, for instance, from 2013 to 2015, as you can see in the slide before you. The lowest performing states in 2013 was reporting about at 0 percentage of facilities reporting. And by April 2015, about 90% of the facilities in that particular state were reporting. But some states, particularly states where you have a lot of the private sector present or where there are certain geographical challenges, continue to report at low rates. And that's something that's in your system you should continue, to work on. But beyond reporting, there's also the issue about the quality of data. And I think we're spending a lot of time on this session because the whole premise of managing performance is based on having data available that's credible and that everybody buys into. So we began to conduct something called a data quality assessment using the routine data. So a data quality assessment, or DQA, just reflects the availability of data, the consistency of data, and the validity of the data being used. And so this, for instance, shows that in the particular state in question, there are opportunities for improvement in terms of the quality of data. But these are things to note, and these are things to focus on in your performance management routines. And then now, we've talked about setting targets. We've also talked about the different data sources, whether it's survey data or routine data. And now, the next thing is to actually review the data. Because after data has been reported against targets, sense must be made of the data. It's not just enough to just collect data and collect data. It's important to distill the so what of the data. So what is the insight that you draw from the data? So regular performance reviews are key to addressing the bottlenecks and the issues that the data actually throws up. For instance, one tool that's useful in terms of data review is the scorecard. Here we present, an accountability tool that we use for the Saving 1 Million Lives initiative, where we had a scorecard for a state. So for the very busy policymaker, this gives him a snapshot of performance. Areas where you are performing well, you could color code green, and areas where there are challenges, you could color code red. And that immediately focuses the policymaker on those particular areas. And in order to generate the scorecard, it means that you have compared this against this particular target. You have determined and reviewed the data to see whether the level of progress being made is satisfactory or not. The other thing to do in the review part of the performance management cycle is some analysis. In the slide that follows, the analysis, for instance, is comparing performance across states. And you can compare across, rural versus urban regions. You can compare across by gender, by states, by regions, by local governments, etc., depending on the data you're collecting and the insight you're trying to obtain. For instance, we had here that even though the LLIN ownership was high across states, its use, for instance, was relatively low. So we not only compared across states, we also compared ownership with use. And clearly, it was a problem for us to focus on in Nigeria and informed a lot of things, changes we made to the malaria program. The third slide actually looks at some more analysis in detail. And now the level of analysis you would need to perform depends on the fundamental issue you're trying to address. Here, it was more of a bottleneck analysis, right? So we found that Nigeria was able to test 95% of fever cases with microscopy or rapid diagnostic tests. In terms of treatments, we're able to treat 90% of uncomplicated cases, as we can see. However, with regards to prevention, it was a different story. utilization of preventive measures were very low. We were unable to collect data on households using the indoor residual spraying. We found that only 23% of children under 5 were sleeping on the bed nets, and only 12% of ANC patients were receiving the intermittent preventive treatments for malaria in pregnancy. So in summary, we could easily see from this very simple bottleneck analysis that the problem with Nigeria's malaria program at that time was prevention, not necessarily treatment. So clearly this would mean that, as a result, we were being pointed in the direction in which we needed to intervene to achieve our malaria targets. The last step in the performance management cycle is the revision and implementation of corrective actions. So based on the challenges identified, such as the constraints in the preventive efforts in malaria eradication, you have to come up with corrective actions to do something about it. So this is the value of the performance management cycle. It's not just to set targets, and it's not just enough to collect data. The data must be reviewed. And after the data has been reviewed, you've identified the issues. The next step, naturally, is to actually do something about it. And here, strong leadership and resourcefulness is critical to actually identify areas where you can actually intervene in. In Nigeria, for instance, the charts before you shows that we made a commitment to tackle both supply, demand, and capacity challenges in the elimination plan. So for each category, the bottleneck was identified, the specific issue named, the corrective action proposed, and very importantly, responsibilities were assigned to specific individuals. The implementation plans at this point can either then be updated, targets could then be revised, taking into consideration any new realities that going through this cycle may have actually uncovered. So this sort of completes the performance management cycle. Remember, it starts with identifying the targets, and your targets need to be context specific. Secondly, you need to then think through how you will collect data that will give you information at the frequency which you need, looking at both the availability of data as well as the quality of data. And thirdly, you need to go through your reviews where you analyze data to obtain insights from where the bottlenecks are and what the issues are from your data. And then lastly, you need to implement corrective actions and where necessary, revise your targets again. And that puts you through the cycle until you achieve those targets, and then you can then exit the performance management cycle. Thank you.